Communication and language in autism spectrum disorder is very important, that has to be discussed. So I'm here to talk about certain aspects of those concepts. Though communication and language work together, they are not the same thing. Communication is done by every living object here. For example, animals and birds do communicate through singing, through their own vocalizations. Humans do by body language, facial expressions, etc. Whereas language is considered to be the highest form of intellectual interactions. They have symbols that has to be encoded, understood by another individual who understands the same language, right? So when it comes to autism spectrum disorder, there is a lack of communications from the time of birth. For example, children have to mutually give an eye gaze with the parent and build a bond or a connection with them. They have to develop certain gestures or body language or facial expressions in order for the parents or the caregivers to understand them. Early communication skills such as joint attention or pretend play is also very important in these children, which is tend to be lacking according to the research with children with autism spectrum disorder. So it is safe to say that communication always precedes the language development. One important sign would be the gestural development, which is considered to be one of the factors before word production and comprehension, which is seen to be lacking in high-risk children before 18 months of age. Now, what do we do for these things? It is recommended to pick up these signs early as possible by a primary caregiver or a secondary caregiver in the early ages of these children. Consult a speech and language pathologist or a therapist who does a detailed or a comprehensive evaluation or an assessment to understand at what age the child stands. Early recognition leads to early intervention, and children with autism spectrum disorder respond very well to a highly structured or a specialized programs. I would like to conclude saying that all the primary caregivers or the secondary caregivers must be alert and attentive to these signs, which will develop way before the child starts their language development, which can be treated early, and then we can help them as early as possible. For any more queries regarding the language development or the communication development, you can reach out to Marga Psychiatry Hospital, which is situated in Yelahanka. Thank you.